Hello, I'm Dr. Keshava, President of Karnataka chapter of CSI, Cardiologist Society of India. Today, we are going to talk about Cardiopulmonary Resuscitation, which is a training certification program along with sponsored by Cardiologist Society of India, where we are going to train a community of people in the process of learning how to do a CPR, training and certification. Heart is a pump which keeps pumping blood. 5 liters per minute is the amount of blood needed for the entire body to function. If the heart stops pumping, you call it a cardiac arrest. What is a heart attack? Heart attack means heart is supplied by the coronary arteries. If the portion of the heart supplied by the coronary artery is blocked, it causes a heart attack. A portion of the heart muscle dies, you call it a heart attack. So when the heart attack is there, a portion of the heart muscle dies, whereas a cardiac arrest means complete stopping of the heart pumping, which results in no blood flow. So all the organs, including the brain, suffer damage within 3 minutes, and which will cause a irreversible brain damage. This is what you call a cardiac arrest. How to do a CPR? First, call for help, call for medical assistance, take him to a safe place, start the compression. Compression should be in the lower part of the sternum, 100 to 120 beats and 120 times a minute, and at least 5 centimeters of compression will in the lower part of the chest will start initiating the CPR. Now we are demonstrating about cardiopulmonary resuscitation, CPR. First, call for help, call for medical personnel to attend. Next, check, move the person to the safer place. Third point, check whether the person is responding. Hello, Hegidira, how are you? Second thing, check the respiration. See whether the chest is moving or the breathing effort is there. Third, check for the pulse. You see for the pulse is not there, person has a cardiac arrest. Now you start the CPR. Use the palm of your hand, keep it on the lower end of the sternum. If you are a right-handed person, right should be the lower, left should be upper, and watch your this thing, you have to be perpendicular, start compressing 5 centimeters. This is the way you go, and you start at the rate of 100 to 120 per minute. Note, you are not bending the elbow. Bending the elbow takes away the effort. This is how you start the CPR. Key points about CPR thing is, use the palm of your hand at the lower end of the sternum, and the compression has to be 5 centimeters. There has to be a gap between each compression, and it has to allow it to be recoil. After every 30 beats or 30 compression, extend the neck or pull up the neck like this so that the saliva is not aspirated, and keep compression. And don't bend the elbow. And you keep doing compression. Remember, 100 to 120 beats per minute and 5 centimeters and a recoil should be there. Remember, any healthy person can do only up to 2 minutes. You need an assistant, you have to call the other person. When you change from one person to another person, the gap should not be more than 10 seconds. Keep doing CPR, cardiopulmonary resuscitation, till you get a medical personnel help. Come, keep getting trained and certified, and be an active part in saving the lives. Thank you very much.